All right, well, this week we're very happy to welcome Dr. Steve Adelsheim. He's a child, adolescent, and adult psychiatrist and the director of the new Stanford Psychiatry Department Center for Youth Mental Health and Wellbeing. Thanks for being here.
Thanks for having me. It's an honor.
Well, you know, there's been a lot of discussion in our community about how to help youth to thrive and also to address mental health issues. And specifically, there's been some discussion about what exactly can be, could be, should be the role of schools within this whole mix of mental health services and community partnerships. So I thought maybe it would help us for you to just start with your own experience with school-based mental health services, what you've seen, what kind of models are out there, so that we can set a framework for this discussion.
Sure. So, I've been in this community now for just a couple of years, and but I've worked for many years in school mental health. And really a lot of my work actually began working in one component of school health, which was actually in school-based health centers, which are really clinical programs that community providers brought to school-based settings with primary care providers, mental health providers, seeing young people in schools, mostly middle and high schools, and providing direct clinical care and support. We would do a lot of screening to assess sort of the issues for young people, both physical health and mental health, and then have these young people visit with our staff, master's level therapists, nurse practitioners, family practice docs. We have psychiatry trainees, child psychiatry trainees, and psychiatrists, and we would see young people in those settings. And where I came from in New Mexico, that was a model that we built, frankly, across the state because of the rural and frontier nature, difficulty accessing early mental health care and health care for young people. So that's been one model that I've been very familiar with. And in addition to that, a whole other range of supports for young people in schools. One of the things that we really try to think about is the whole continuum of support. And within that frame, we're talking about the social and emotional learning that might happen in the early elementary and middle school years. We think about health and mental health education for young people, families, and also for teachers and staff to be able to understand, early signs of mental health issues, mental wellness, and how to take good care of yourself and build resilient young people. And then also moving to those early models where we might identify young people who might have mental health issues. And then in terms of the school's role, especially around some of the federal laws around child find and special education, the issue of then how schools work to identify young people who might have issues that could be impacting their ability to benefit from their education due to a mental health related issue. And then we look at sort of the special education issues and look at those kinds of supports. So we're really talking about a whole continuum from education to prevention programs to identifying young people at risk to then linking them to services that are both provided by the school but also maybe community providers on site, in the school setting as well.
I'm curious, is that kind of a model you described, so it's external providers within these centers in the schools, does that create a stronger connection between the schools and healthcare providers in the community? I know that's been an issue here of really wanting to do that. It's called the warm handoff from the schools. If a student needs to be referred out, but I've heard a lot of both just because of the high demand and because sort of a disjointed system, it's difficult to do that here. And I'm wondering if you could sort of compare the two models.
Well, I think it's difficult to do it everywhere.
Yeah.
Right. And I think even when we're looking at adult services from institutions or even from primary care to mental health, those handoffs are difficult to do. We like to think about school mental health services, obviously, because it's where the kids are and they're comfortable environments for young people to be able to access care. When we're looking at how to build those structures, we're trying to find ways that we can link young people early. For the community partners, it's an important way to be able to have access to young people very early. We have data now that says that half of all mental health issues start by the age of 14 and 3/4 of the time by the age of 24. but we don't have many great health systems or public mental health systems to make it easy to have young people access early care. So the school is a great place to do that. And so when the providers are there on site, it does become much easier for young people to quickly access that support. Sometimes if then the providers recognize mental health issues that might be impacting that person's education, they can easily make that connection then back to the school and let them know so that that young person and family can get the right accommodations for their mental health issues as well, academically.
One thing that we've seen in the wake of 2 suicide clusters is the activism of some peers within the whole support system. And I'm
Right.
wondering if there are certain roles within education, prevention, intervention, postvention that some groups are better suited for, whether that might be, I mean, one question is like, are school service providers, school staff really equipped to be providing or intervening? Are they trained well enough, or is that a role that really the mental health providers in the community should be providing? So what roles can different
Right,
groups
it's a really
play?
good question. I think, my experience is that when you look at the school health professionals and school mental health professionals, whether it's the school nurses or the aides working in schools or school counselors or school psychologists or school social workers or other folks, most of them have certainly some degree of sensitivity and some component of training around mental health related issues. At the same time, they're managing so many issues. It gets sort of difficult. And I think just even on an individual basis, if you look at the national organizations for school counselors really includes, that role providing, potentially that mental health support, but also the academic support, but also the college counseling support. And all of those key components are critical for that role. And I think just like, the rest of us in the work that we do, some people in each of those fields gravitate to particular parts of that role that they feel more comfortable and energized by. And so I think it varies from school to school in terms of the level of comfort. I think, our school counselors are, I think, very well trained to provide that support. I think some have more interest in it than others or feel more comfortable doing it than others. And I think the same is true for some of the other folks in the other fields. I also think, what gets complicated when you have providers coming into the school is that there's some of those providers that really can adapt to school culture, can be flexible, can be good community partners. And then there's some that just sort of walk in with the expectation of, I'm here to do my job and see my students, and they're going to come and go from my little room in the school. And they're not really developing, as great a sense of what it means to be part of the team. And so, there are certain skills that I think people have to have across the spectrum to be able to work well, in supporting youth with these issues, whether it's from the school side or from the community side.
Is that something that that sense of how to be within a school, how to be a service provider within a school, or how to be a school that is enabling mental health service, is that it's something that you do in your work as a community partnerships person with the Stanford Center?
Well, we do. And I think there are other programs that often do that well. The program that we have actually through our Psychiatry and Behavioral Sciences department, we have students both that are in our partnership program with Palo Alto University who are working towards advanced degrees in psychology, that are in some school settings that are being supervised by some of our psychologists. And our child psychiatry trainees are also in the schools providing consultation in the Palo Alto schools and the Mountain View schools as well, in East Palo Alto Academy. And they are supervised by our child psychiatrist, by Dr. Joshi, who I think you know, and by me as well, to be able to learn how to work in a school culture type of setting, so that when people finish, they can do that. And I know for me, when I was in training, I spent a year as a child psychiatry trainee working in a school-based health center, a day a week, which really led to my ongoing interest in being involved in this work over time.
I don't want to leave the New Mexico experience before asking you, what kind of lessons were learned in doing this primary care, mental health care on the school campuses? What kind of takeaways or results did you see from that kind of model?
Well, I think one of the issues is that I think we learned was that there was real value in being a community partner. Some of the issues were a little different in terms of when you weren't necessarily employed by the school or weren't funded by the school. You had a little bit more flexibility in terms of confidentiality, in terms of conversations.
Which is so important to the
Which is
students.
important to our young people right now as well. I think one of the things that was really a little bit different from a lot of the models that I've learned about here in California is that they don't often include the integration of primary care and mental health. And one of the things that we sort of learned is that for some young people, it was more comfortable due to the stigma issues around mental health to go see the primary care provider first for that headache or that stomach ache or whatever the issue was. And by the second or third visit, we would get to the mental health issue and then be able to do that warm handoff to the mental health provider because it was easier to walk into the primary care door first. So having the ability to provide both types of support up front, I think had its own value. And then I also think, we worked in a variety of culturally different communities, and really being able to look at cultural support around interventions is very important in terms of doing this work, whether it's in schools or in whatever community one's looking at.
I don't know if you've been following the school board's conversations on any of this, but they've been grappling the past few weeks with various proposals from just a coordinated wellness center model. There's talk of a distributed counseling model. Should we focus on social emotional learning curriculum
Right.
first and then a delivery model later? And you can tell that they're sort of, there's a clear issue here that needs to be addressed. There's high demand of the services, of direct services at the schools. Clearly there's the issue of stigma, wanting to tackle stress, all these issues that the community has been talking about for the past year or so. But they seem sort of unclear on the best way that the schools can really address it and make an impactful difference in a new way, because there are certain aspects of the system that don't appear to be working. I don't know if you have any insight into that, or if you sort of watched that process before in a different community.
Well, I've been involved in communities that are trying to have that sense, and I think, my sense of the struggle you're describing is really a little bit of where on the continuum to start.
Yeah.
Because I think it's all really important. And then with it, I think some of the questions are, what is the role of the school in providing mental health support more broadly versus sort of the primary education role? And where does one begin and, in the other end? And so I think it seems like that's behind some of the questions that are being asked. And I think then what's the role of community partners in really providing the other support? And I think it's tricky because there are sort of in educational law around special education, Section 504, which is a law that really supports people with some type of disability to get accommodations in their classroom or other settings. There are certain sort of legal obligations the schools have around educational support for young people that might have a mental health issue. And then there's the issue sort of the general population that maybe aren't having, issues that impact their education. And so I think it's not an easy line sometimes to differentiate. But we still need to support the needs of all of those students, whether it ends up being legally a school's responsibility or not. And I think certainly given the issues that have arisen in this community, having that whole continuum, is that much more critical.
Something that I know you're looking at is this headspace model, which is an Australian really large network of free youth mental health centers. I was wondering if you could talk a little bit about that model and sort of what you're trying to do with it here locally.
Sure. So as much as I've spent 15 to 20 years doing school mental health work, I think I also have had the sense that when it comes to support for young people for early mental health needs, we don't often still have easy access for young people to go in a comfortable way to get early mental health support in an integrated care setting. And Australia really has made a commitment to that, and frankly, other countries have as well. So this headspace model is really based on creating standalone walk-in clinical programs for young people 12 to 25 to be able to walk in on their own or with a friend or with their family and access early mental health support for more mild to moderate mental health issues, and then be able to link to higher end services if needed. The programs all really have core components of mental health, early primary care, early support for drug and alcohol issues, and then some supported education and employment services. And by the commitment they've made in the Australian government, there are 90 of these sites around the country, in a country that's half the population of California. And they're going to have 100 by the end of this year. And it's a model that has worked very well for helping young people feel comfortable going in for early support. They direct market to young people, advertising, they go to concerts, they go to youth events and advertise and help build access. They partner with the national football leagues and rugby leagues
Very
and
youth
other
driven.
programs to, bring some of the stars that, youth might want to emulate to say, come get mental health services, and they're really destigmatizing early support. So I think that's an important model. We'd like to see, to be able to start some of these sites in the United States, and we'd really like to maybe start that here in the Bay Area. So we've been having discussions with our counties here in Santa Clara and San Mateo, Alameda, and even other conversations with people across the country that are very interested in thinking about how do we build this front end sort of public mental health model that really doesn't yet exist in our country. It's now in Ireland, it's now in Denmark, it's now in Israel. They're starting to build these sites in British Columbia. So it's a model where other countries are making a real commitment to young people for early support, and it'd be exciting to be able to do it here.
Yeah, I was talking with a gun student about it, and she literally said, that would be my dream site to happen here and sort of solve a lot of the issues. It wouldn't be
Yeah.
the silver bullet, but
Well,
really
we've been
help in a lot of
talking to some
ways.
of the students, both at Gun and Pally, and met last week with, the Palo Alto Youth Council, and they were very interested. They suggested maybe we should do a survey of the students here to get their input on would there be interest in the model. They have a survey subcommittee that suggested maybe they could put together a survey with us, so we're talking about doing that.
I'm kind of curious where these headspace locations would be. Would they be like in a shopping mall because that's more accessible, or is there still this sense of like we need to locate it somewhere where no one's going to see you going in?
I think it's a combination. I think, when you look at, I've been to 7 or 8 of these sites in Australia, and they might be like just off the shopping mall. But, in Australia, you can't drive till you're 18. So they're near bus lines, and they have to be accessible sort of in terms of public transportation, and we would want to do something like that too. So they might not be right on the strip of the shopping mall, but they might be right down the street from it to be easily accessible.
So they can get there. And,
Yeah.
Yeah. So one big issue that has been discussed is academic stress in Palo Alto, and especially in terms of the question, does all this stress actually lead to type of mental health, mental illness or mental anxiety that is something so serious that we need to be addressing it in a kind of big programmatic way. Obviously there are people who have a predisposition towards mental illness and, as you were saying, by their 20s will be experiencing psychosis and things like that. And I'm trying to get to maybe the broader population
Yeah.
who are dealing with stress of growing up here in Silicon Valley and all the pressures that they face.
Well, my experience is that, and as I showed you, I have a daughter in the school district here in Palo Alto. And I have to say, I think we do still see a range in terms of that stress. I think there are many young people that feel a great degree of pressure, and I think it gets shared among their friends. I also think as we're sort of witnessing the changes and some of the losses in this community, I think the dialogue around really what's important for our young people and their families, I think is starting to have an impact as well. So I think we are starting to see a little bit of a shift, and I think as I've been meeting with young people, in terms of some reset of what priorities really are, I think is really there. Part of what we're also really trying to do is some educational outreach to parents to talk about this issue in terms of, how do we support our young people around managing this stress. We're seeing programs in school to help young people learn stress management, whether it's sort of these meditation and breathing programs or yoga type sort of models as well, but also, helping young people sort of learn the critical aspects of self-regulation, which really are the developmental issue, really, at this point, during this really critical, we call it the second 0 to 3 in terms of brain development, from 12 to 25, where your brain really is going through a whole readjustment again. Where learning self-regulation is a critical piece. So while I think there's certainly have been issues of stress in this community for a very long time, we're trying to educate everyone about maybe shifting priorities a little bit, and I think it's starting to resonate some.
As part of the new center, I understand that you were doing focus groups or are doing focus groups with youth. Is it youth and families or youth?
Youth and families,
Okay.
yes.
I'm curious what you're learning, what maybe has been surprising from what you've heard from them, or not.
Well,
what you
I
expected.
think some of the things we've really been learning are really just what we've been talking about to some degree, that young people do feel a lot of stress. I think the point Elena was making that there is a real interest in being able to find some confidential place to get mental health support that I think young people don't necessarily see as available in the community here very easily. And so I think as we've been looking at this headspace model, for example, some of the focus groups have sort of reinforced the potential benefit of sort of these separate sites to get some additional care. I also think we're seeing families really asking for more education around how to communicate with their children, how to get support. And maybe it's a little bit of a biased group because these were parents that wanted to come in and join our focus groups, right? But I think families are very hungry for education around how to address these issues in a way because they want to support their young children. They also really want them to be successful. They see the pressure everybody's under, and I think, are looking for ways to address those questions.
I'm curious, just to get your take on the current demand in the community. I know over the course of the last year or so, in the wake of the suicide cluster, I was hearing anecdotally from students and families just crazy long wait lists. You can't see anyone in Palo Alto immediately. You have to drive, wherever you have to drive to get an appointment with a psychiatrist. Might not be someone covered by your insurance. Just really have a lot of barriers up given the really high demand. Has that slowed at all? Have Stanford found ways to accommodate the demand? What's the sort of current status of that in the community?
Well, I think the reality is this workforce issue, particularly around child mental health, is a huge issue nationally, to tell you the truth. Earlier this week, I was at the meeting of the National Council of Behavioral Health Care, and, what we kept hearing about was the workforce needs, and particularly around child mental health. And really of almost all medical professions, child psychiatry actually is sort of one with the greatest need of all medical professions. And so, we're hard to come by. And so, in New Mexico, part of what we did to build access was use televideo quite a bit and be able to use televideo to link out to other communities, to train other providers in rural and remote areas, to learn how to get support and then be able to back them up through consultation, case presentation. And so I think part of the issue here is because of the similar access issues, we need to continue to work to be able to build our capacity across all of our programs. I think they're all, I would say, fairly maxed out at times. And the issue is, it's hard often to recruit people to the community here because the cost of living makes it very difficult. So I think as much as we can provide good support for the people that are here to stay here is an important piece so that people don't feel overwhelmed and they don't get burned out. I think that's important. But I think, as you're saying, I think there's a lot of work for us to do to continue to sort of build the whole range of workforce to be able to build support.
Sometimes when in looking at the issue of youth mental health, we've come under the community, we've come under the scrutiny of national media, of course, looking at the epidemic. I'm just curious because collaboration is challenging.
Right.
What you've seen that Palo Alto is doing well, doing right, and maybe should be doing more of.
Yeah. So one of the things that's been exciting for me is to be able to learn about and get involved with some of the really very supportive community collaboratives here. Project Safety Net has been one group, that's been in place here for a number of years now, that has been very active in providing a place for different groups to come together, in partnership with the city, with the school district, but also families and community agencies, an important dialogue. And one of the things I think Project Safety Net now has a new executive director, Mary
right.
Gloner, and really is sort of looking at how to maybe shift the structure in a way that better supports broad-based communication and meets the needs more actively of the families and communities and all the partners. And they've done a great job, and I think it's a very good time now to be sort of asking those questions. In addition, there's the Herd Alliance, which has been really a group of people from the community with real expertise in health and mental health and suicide prevention that really have provided incredible support through their suicide prevention toolkit and really sort of working closely with a variety of programs around meeting health needs. And so I think those partnerships have been really strong. I know the school has been really quite proactive in building support, and the city has, shown great leadership, I think, as well. And the voice of families has been great, and particularly then the young people. Our students have been a great voice of bringing everybody back to the realities of the situation and really being great about speaking to the needs we have in our community, whether it's been making movies or serving as peer supports for other students. Our young people have really gotten very proactive in a wonderful way.
So let's turn our attention just in the final minutes to the Psychiatry Department Center for Youth Wellbeing.
Sure.
What is the direction of that effort? What initiatives are you working on or planning as
So
goals?
some of the work we're doing is to really look at how we as a psychiatry department can really continue to expand our community collaborations in terms of the school-based programs here, but also working with other districts that are interested and looking at school mental health support, looking at how do we develop these models like headspace to be able to be more proactive in the community. We want to be sure that our trainees, as we were discussing earlier, are more involved in the community so that when they finish our programs, really have a commitment to be strong community partners. And so that's been an important piece. And then we've also been looking at technology issues because, young people are busy on their smartphones and looking at how we can support the use of technology in a way that supports the well-being and mental health of young people as well.
That sounds like a lot on your plate.
It is, but it's very exciting and wonderful work.
Well, Dr. Steven Adelsheim, thank you so much for being our guest today. We really appreciate your insights.
Thanks for having me.
For all the latest news, you can check us out on paloaltoonline.com or follow us on Twitter at Palo Alto Weekly.